Good afternoon, everybody. My name is Michael Freeston. I'm Director of Quality Improvement at the Early Years Alliance, and I'm joined this afternoon by Melanie Pilcher, our Quality and Standards Manager.
Good afternoon.
I'm trusting everybody can see the slide which says Managing Food Allergies in an Early Years Setting. I trust that's the case. Can I just please have some hands up for those of you who are with us? And the technology has done something weird to me today. It's on a different screen. Yes. So we'll see how far we get.
Keeps us on our toes.
By way of introduction, just a few words from me before I hand over to Melanie. This has been an issue from which we've received increasing numbers of calls to our membership and information line. There've been a spike in circumstances over the last few weeks, and so we had a request from the team who take calls from members and the wider sector, just asking if we could do a general overview webinar on the issue of allergies, and so that's what led to today's session. So it also reminds me to say to everybody, if there are particular topics that you feel will be of interest, then please let us know at the Alliance, and we can look to construct webinars that will go out to the sector as a whole. The other apology I have to make is we now have builders refurbishing the office block directly opposite me, and they've just decided to turn their cement mixer on. Hopefully that won't affect us too much, and it will be clear. If there are any problems with sound, do please write in the question box, and I will attempt to shout into the microphone or something. Just a few words for those people who have not been with us before. A webinar is just the same as a seminar, except it's done over the web, which means we're able to speak directly with far more people. But it does allow interaction to come back from you. You should have a little toolbar that's popped up on your screen. If you just type into the box there, that question just pops up on my screen. Nobody else will see it who's attending the webinar. So there are no such thing as foolish questions. My task then is to try and seamlessly weave those into the presentation. Doesn't always work, but we will attempt to address all questions throughout the process, throughout the program. But also, if there are any other issues you wish to raise or make any comments, please do not wait until the end. Just type them in, and we'll feed them through. So we will do about a 25 to 30-minute presentation. We will have time at the end, but as I say, please don't wait because you might forget your question. Just type it into the box and it will appear on my screen. Without further ado, Melanie.
Thank you. How nice to have a backing track when we're presenting a webinar. Yes, brilliant. Yes, as Michael said, this is a bit of a hot potato at the moment.
No pun?
No pun intended. The issue of allergy management and food allergies, and nobody can have failed to have seen several really distressing media reports over the past 12 to 18 months where children, older children admittedly, have died because they've been exposed unnecessarily to an allergen. So what I want to do in this session is have a little look at what we mean when we're talking about allergies, and to make some suggestions for how allergy management should look in your settings. So let's just go over the basics first. A food allergy is when the body's immune system reacts unusually to specific foods or other allergens, although we are focusing more on food allergy. I don't want to dismiss the other allergens.
Would be grasses or things like that?
Yes, so the sort of the airborne allergens that we normally think of, and also the topical allergens, so things that have contact with the child's skin that may cause a topical allergic reaction. But we're focusing this afternoon primarily on food allergy because this is where there is this huge risk of anaphylaxis and ultimately death. Most allergic reactions are mild, but they can be very serious. And I think this is sometimes where we tend to get complacent as well by thinking that we're just dealing with a potentially a mild allergic reaction and forgetting that the next time it happens, it could be more severe.
Right.
There's no such thing as a mild allergy. there's only a mild allergic reaction.
You've actually just answered Diane's question, which had come in. She'd said that her parents has come and told her that her child only has a mild allergy. Is this correct?
No, absolutely not, because it might be a mild allergy or a mild reaction at the moment, but that could change. So the point that I will keep making as we go through these slides is that, you know, any allergy that's reported to you must be treated in the same way.
I may be preempting something as we go forward. What's the difference between an allergy and sensitivity or dislike? Yes. Or you see my point? Yeah.
Yes, I mean, we will look at those slides a little bit later, so I won't say too much now, but there is a clear difference.
Fine.
And the difference being in how they're managed and how medical treatment is probably, if it's an allergic, if it's an allergen that's been identified, then there will be a medical input into that.
That's it, right. Thank you.
Okay, but we'll talk about that a bit more later. Most food allergies affect younger children under the age of 3, and it's estimated, quite surprisingly, that 1 in every 14 children of this age has at least one food allergy. That's quite surprising,
well, that
isn't
is,
it?
yes.
So again, we'll be looking at what the implications for that are, and actually some of the reasons why that might be. And we know that there's been a rise in the rates of food allergies over the past 20 years. And if we just move on a couple of slides, I'll be talking in a minute about what the most recent reports are starting to say as to why that might be. But as of 2016, we know that allergy is the most common chronic disease in Europe, with up to 20% of patients with allergies struggling daily with the fear of a possible asthma attack, anaphylactic shock, or even death from an allergic reaction.
Can I ask what EAAC?
I know you were going to ask me that, and it's completely gone out of my head.
Sorry.
But, yes, I know. I just looked at it and I thought, I bet somebody's going to ask.
European Allergies Agency Comprehensive Institute.
It's certainly European Allergies something.
Fine.
Okay, so apologies for not being more diligent on referencing.
Can I just ask a question? That pointed to the previous one about an increase in the past 20 years. Is there a generational issue here for practitioners then, in as much that when I was younger, allergies wasn't an issue, and so I may generationally not take it as seriously as it requires?
Could well be, and which is why it's so important to have these discussions in a team, because I think you need to know what everybody's perspective is on it, and people's own personal experiences always affect how they deal with an issue. Okay, so here are a few headlines that I've scanned over the past 18 months, and all these headlines are serious. They are all high profile, and in my mind, in early years, we are perhaps only one incident, near miss away from a similar headline, which is why, although all of these headlines refer to slightly older children, I wanted to make the point that, you know, for any of us, it's a case of, you know, we could be there.
Just on the older children thing, and I'm possibly taking this to a medical level that you're not able to answer, is there a cumulative aspect to it that actually, if these are becoming fatal issues later on, is there an element of cumulative impact?
I think it's more about a circumstantial impact, the circumstances that lead to these things happening in the first place. And as you quite rightly say, I wouldn't like to go into the medical detail of this, but actually, you know, from what the Allergy Association UK is saying, you know, there are circumstances that are certainly adding to the increase of cases.
Thank you.
So if you move on to the next slide, I think that might...
Before I do, I just want a related thing. Diana's asked the question, do children grow out of allergies?
They can grow out of some allergies, such as peanut allergy. It's quite common for young children to have a peanut allergy, which they then grow out of as they get older.
Oh, right. But that's a type of allergy, not the child themselves.
Not the child themselves.
That's interesting.
And of course, we can't make assumptions that, you know, that because they've got an allergy when they're younger, that they will grow out of it, because they don't always. But statistics do show that some children do grow out of certain allergies, certain food allergies. And even as recently as 3 weeks ago, again, another headline in the paper, which tells us that hospital admissions of children aged 11 to 18 have seen a 65% increase over the last 5 years. And that's quite a significant increase. And alongside that, there's been a 36% increase in children that have been treated for anaphylactic shock over the past 5 years due to exposure to an allergen. And obviously, an anaphylactic shock is the most serious allergic reaction that you can get. And this is where we start to sort of peel back on what some of those reasons might be. And it's suggested in this newspaper report that indoor lifestyles, leisure pursuits and so on, the fact that children are more sedentary now, the fact that we've got higher obesity levels, the fact that children spend more time indoors than ever before, and certainly the generational thing, you can probably think back to your time playing outdoors and how you spent your leisure time. And that access to the outdoors and the outdoor environment helps to build up our resilience.
So it's a failure to develop resistance and resilience.
This is what's being suggested, and I'm sure there's going to be a lot more research done into this, but it's certainly being suggested. And one of the London Children's Hospitals claims that schools also appear to be failing families as well, that they're not taking this seriously enough. And again, sorry, I forgot to mention before that children are more likely to eat out at fast food restaurants as well than ever before. And if you think about the increase of fast food as a mealtime choice for many families, the availability, the affordability of foods that are bad for us being more affordable sometimes, again, children are more likely to be exposed to allergens. And we know there's some of the big high street chains there that have been taken to task over their failure to inform parents and children of the allergens that their foods contain.
Thank you.
So lots of things are contributing to that. So the DFE has just reminded us as well that children with medical conditions should be properly supported. And if you see the screenshot there, supporting pupils at school with medical conditions, it says school on the front, but this is the guidance that's relevant to early years as well. It's what we have, it's all we have, there's nothing specific to early years, but this is the one that you should be looking at. And your policies and procedures should be drawn from this guidance.
And I think that's interesting. It is a medical condition. It isn't a fussy eating element, or it is a medical condition.
No, absolutely, and it's got to be treated as such. There's no excuses for failing to meet a child's medical needs. Which brings us on nicely to the fact that allergy management is in fact a safeguarding issue. And I must admit, I had to think around this a little bit before I made this proclamation, if you like. But when you look at the EYFS, it reminds us that providers must take all necessary steps to keep children safe and well. And if a member of staff fails to manage a child's allergies, i.e. they do not follow your procedures, they do not take appropriate action to prevent a child from having contact with a known allergen, and then we look at the criteria in working together for what constitutes an allegation against a member of staff, and we see the two criteria that jumped out to me. If you fail to protect a child in this way, then you've behaved in a way that's harmed or may have harmed a child. And also you've behaved in a way that indicates you may be unsuitable to work with children. Because again, the key point here is there is no excuse for failing to manage a child's allergies correctly.
That is an interesting point, isn't it? That really brings it home that this is a potential for serious harm to a child, and therefore it is absolutely pertinent that it's given consideration, and takes us back to that point you suggested earlier on in terms of that discussion within the staff team about their attitudes to allergies and ensuring that there are no reactions in the setting. And it will be interesting to pursue that conversation along those lines of, do you acknowledge this as a safeguarding issue within the team?
Exactly. It's about putting it into the correct context in the first place. And we talk about things like this being, oh, it was an accident, you know, but when you look at the definition of an accident is unplanned and unforeseen. If you know that a child's got an allergy a recognised allergy that's been confirmed by a medical practitioner, which I'm going to talk about more in a minute, then you should have appropriate measures in place to ensure that that child does not get exposed to that allergen. Therefore, if it happens, it cannot be described as an accident.
No, thank you.
Okay, so let's have a look now at some of the possible symptoms. The symptoms can affect different areas of the body at the same time, and also these symptoms can develop over time as well. So what starts off as a slight rash could well develop quite quickly. Swelling of the face, around the eyes, the lips and the tongue, again, you can, in a severe reaction, you can actually see that happening in front of your eyes. Child having difficulty breathing and vomiting. But there may also be symptoms that a child has shown in the past that a parent has reported to you, and that's why it's vital that those must be recorded on a healthcare plan.
So those might not have occurred in the setting, just the parent is aware of them and therefore should be encouraged or should notify the setting to look out for these.
Definitely, definitely. This is about that important, vital link between home and the setting where information is exchanged, and when things need updating, that the parent knows there is some responsibility on them to make sure that happens, but also for you to prompt them regularly.
Oh, right. Sorry if this gets medical again and tell me you can't answer.
I will. Okay.
Do different allergens cause the same responses in each child, or might a child respond differently, show different symptoms in response to the same allergen, if that makes sense?
No, I think I can answer that and say no, categorically not. So,
right.
You know, you could have different range of symptoms for different, there's no consistency.
I see. Thank you.
That.
Thank you.
It might be that if it's a mild reaction, that a child does react in a specific way, but that's not to say that the next time it won't be completely different.
Okay, thank you.
And just sort of continuing on looking at the symptoms, even where an allergy is not life-threatening, it can cause pain and discomfort, vomiting, diarrhea, itching or wheezing. And the point to make here is no matter what the severity of these reactions are, it's never acceptable for us to make a child poorly or to put them at risk through poor allergy safeguarding. And again, I use that word safeguarding because this is what it's about, safeguarding, taking appropriate action to prevent a child from being at risk. And of course, poor food hygiene practice, and that also means that cross-contamination of foods as well. And I think, you know, again, you should have those procedures in place. There's plenty of information out there to support you in making sure that your food hygiene practices are good and rigorous.
Exactly. And I was thinking that's in terms of your daily risk assessments and ongoing risk assessment. You would never create a physically dangerous environment for children.
No.
So it's the same same mindset to ensure that there is nothing to do with their nutrition or their diet that causes an potential issue as well, isn't it?
Definitely. So let's think about the procedures that we need to have in place for managing food and other allergies. So I would say it's advisable to have a food and other allergies and intolerance procedure in place that details what must be done when a parent tells you that their child has a confirmed food or other allergy.
And I have to ask, who would do the confirming?
This would be done by a GP or a consultant.
Right.
We do get cases where parents with the best will in the world also make assumptions about what's wrong with their child and might just assume, I think Marmite is one I quite often hear about, where a parent will come in and say, oh, my child's allergic to Marmite. And you say, well, on what basis do you make that claim? And it's, oh, because they come out in a rash around their mouth. Well, that's more likely to be a topical reaction rather than an allergy. So it's important when a parent comes to you and says, my child's got an allergy, okay, has this been confirmed? If it hasn't, the suggestion being, take your child to the GP and get this checked out. Because when we're talking allergy, we are talking a spectrum which ranges from a mild reaction through to death. And we need to know, we need to have it confirmed, we need to have medical practitioners involved. You need to know exactly what you're dealing with.
Thank you.
So There are other procedures you may already have that also cover food allergies, so there may be some crossover because obviously nutrition and food safety procedures that you will have in place should detail that you recognise what the 14 allergens are, food allergens are, that you know how you inform parents that there may be an allergen in the menu. Also, food safety in terms of how you prevent cross-contamination, and that comes under your food hygiene practices. The health procedures, of course, you may have the food and allergies in part of your health procedures. You might have a separate procedure that sits alongside. And then finally, your safeguarding procedures, which I've alluded to earlier, which remind us that failing to take appropriate action to prevent harm to a child is actually a safeguarding issue.
Does it follow the same reporting circumstances as other issues of harm to children?
Well, if it meets that criteria,
right,
then yes, it would, wouldn't it? Because if somebody's failed to act to prevent harm to a child, and you need to be reporting that on, you need to be talking to your LADO, you need to actually make sure that you go through the correct safeguarding procedures, and you will have those in place.
Thank you.
So then let's think about it a little bit more detail then. So a parent informs you that their child has a food allergy. You need to be absolutely clear whether it's a food allergy, an intolerance, or a preference. And you record this initially on your child's registration form.
Okay then.
Okay.
Are the symptoms of an intolerance the same as the symptoms for an allergy, and it's just the categorisation that is different, whether it's been medicalised by a GP?
A food intolerance, the symptoms, some of those symptoms could display as the same. So, you know, that sort of rash on the child's skin, the fact that they might vomit. But a food intolerance is likely to develop an anaphylactic reaction, and that's the difference.
Right.
And that's why we're not medical practitioners out there, so we don't make that distinction.
Right.
So until we've had it confirmed by the consultant, by the GP, we treat both as a potential food allergy.
Right, thank you.
Okay. Record it on the child's registration form, as I said. Has it been confirmed? Yep. Or is it undergoing further investigation? If that's the case, you need that plan in place in how you're going to manage it until you've had that confirmation through. And what do you need to know next? So it's handy to have those copies of the consultant reports if they've been done and placing them on the child's file. Then referring to your procedures, which should state that a risk assessment will be completed. And this might be part of an overall healthcare plan, it might be a separate thing, but obviously the two things go side by side. Complete your risk assessment and share it with all staff. You may use bank staff, you may have flexible workers, you may have students in your setting, but that risk assessment is useless if everybody doesn't know about it. And of course the child's parents. And place a copy on the child's file. And if you have a cook, if you're lucky enough to have a cook in your setting, then your cook will probably have procedures in place and also will have a file that they need to add that information to.
And presumably there's the issue of parents or others bringing food in for celebrations or for anything. That's all given consideration there as well.
It has to be, and some settings ask parents not to send food in at all. Other settings will only do this if they know that there's a child in the setting that's got food allergy. But that should be part of your risk assessment. How are you going to manage this? Whether you decide parents can't bring in birthday cake or whatever, I think, you know, this is something that the team comes to a decision about. So your next thing is about the control measures that you agree. So how are you going to manage this? Some settings use different coloured plates or placemats. If you've got a lot of children with allergies, and if we look back at that 1 in 14 figure, the chances are you might have several children with food allergies. So the coloured plates might be a little bit more problematic. And one thing that I started to think around, which talking to colleagues, we feel that this might be a really good idea, is to have a dedicated allergy monitor at mealtimes. Maybe somebody, it doesn't have to be the same person at every mealtime, but every meal or snack time in every area, there is one person who's dedicated allergy monitor whose job is simply to double check.
Right.
The incidents that we hear of, the near misses that we hear of, often happen when somebody just didn't double check and somebody else walks into the room and says, oh, I see so-and-so's been given a yoghurt, they're not supposed to have yoghurt because they're allergic. And everybody says, oh, we didn't realise, we didn't know. So just having somebody give them a different coloured apron, make sure everybody knows they're the allergy monitor that day and they do the double checking. It takes 5 minutes, if that, just somebody to reassure us that nobody's going to slip through the net. So whatever you decide to use in terms of a control measure, which is going to be most appropriate for you, for the setup of your rooms, for the setup of your setting, for the children's needs, but there should always be a control measure identified, at least one. I can't see, if you've got children with allergies in your setting, I can't see there'd ever be a situation where you decide you wouldn't need to put control measures in place.
No.
Complete a healthcare plan. Absolutely vital that it's completed thoroughly with no blank sections. And even if there's a section that you feel you don't need to fill in, somebody needs to write in that section, not applicable, because that shows you've given it due consideration.
Right.
Do that with the child's parents, obviously, because they are the important source of information for that healthcare plan. Add the child's name to a dietary requirements list, if that's what you have, and display an allergy alert poster. We have, if you're members of the Alliance, which if you're watching this, the chances are that you are, our information team have put together an information sheet, one of our mini guides, which has an example of an allergy alert poster, and again takes you through some of these really important steps that you need to take in order to manage an allergy. Have a look at the relevant forms or procedures that you have during your next team meeting. Team meetings are precious. They're precious to us in terms of the time that we spend on them and the content that we put into them. But spending 5 minutes just looking at your procedures, discussing with each other is just vital.
Before we move on, Melanie,
yes.
I just had a question from Catherine. We have a mother who had notified us of her 2-year-old's lactose intolerance, and again, intolerance, allergy,
yes.
We'll take it as that. We put this onto a health and care plan. She didn't tell us a few weeks later that she was reintroducing in an aim to try and desensitise. So there's an issue of keeping things up to date, presumably, is I think Catherine's point.
Yeah, absolutely. And the importance of the healthcare plan, making sure that you have regular review dates in there and that people stick to them, and that you actually chase up the parent and say, okay, we said we were going to review this weekly, fortnightly, monthly, whatever you've decided, but ensuring that somebody, key person, manager, whoever it is, goes back to the parents and says, we just need to review this. And also, when you're doing that in the first place, just reminding parents of the importance of sharing that information with you. It's got to be a partnership between the setting and the parent or the carer, the main carer.
Thank you, and thank you, Diane.
And then finally, then, to finish off this session, I'd like to just remind you of some of the key things that we've talked about and a bit of a checklist for you. Are daily or weekly or monthly menus displayed for all parents on a notice board? Chances are that yes, they are, because it's something that Ofsted require us to do anyway. But do you inform parents of whether your menus contain any of the 14 allergens as required by law? This law came in about 5 years ago, I think, where any food business, anybody providing food, whether they're selling it or just providing food on a premises, must inform people of any allergens contained within that. And if you look back on our YouTube site, you will find somewhere we did a webinar about this at the time, actually looking at those. So do have a look at that if you think that maybe you're not really doing that effectively. Then we've got the importance of making sure that staff are trained to use EPI or AniPens as required by your insurance provider. So if you're not sure, check.
Thank you.
Okay, and I would say to you, have your staff undertaken the free online allergy training. Michael and I are not medical experts, nor do we claim to be. Therefore, if you want to know more about allergies, particularly in terms of the medical impact, you really need to have some formal training in place. This one's particularly good. It's free. It doesn't take very long to complete, and it just really helps to give you the confidence to know what you're looking at when you're talking and looking at children who may have allergies. And asking yourself, is everyone confident in allergy management practice in the setting? It's no use just saying, well, it's the key person's responsibility or it's the manager's responsibility. Every person right down the line needs to be aware and confident in what they need to do.
And I think there's also a situational element there, isn't it? Because meal times are fluid, aren't they? They are. People are coming and going, plates are being moved around, children are possibly sharing, or etc. There's the potential for things to not go as orderly as we would desire are huge, aren't they?
They really are, and I could almost go on to another tangent now about dynamic risk assessment.
Yeah.
So you've got your written risk assessments, which are hugely important, but that idea of dynamic risk assessment, that idea that at the time of the event, you're constantly assessing the situation and taking actions that you might need. Children are dynamic. They don't stop moving. They are constantly doing things that surprise us. And because we want them all to be good children and we want them to share, they quite often want to share their lunch with the child sitting next to them. So we've got to be dynamic in our approach to this as well.
Thank you, Melanie. That's fascinating. It's not a subject about which I knew a great deal, and that raises so many questions. And I think for me, the big takeaway is taking the matter seriously and ensuring that the setting as a whole recognises the singular importance of this as a healthcare issue, not as faddism or something which will be here today and gone tomorrow. This is, for those of you who are new to us, this is my 2 or 3 minute waffle at the end of the session, just while anybody else has the opportunity to type in. But I don't artificially lengthen the session if there isn't any, and especially with this man drilling outside. I don't know if it's being picked up by the microphone.
They should be clocking off soon.
Yeah, they should. It doesn't look like we've got any more coming in. It just remains for me to say thank you for everybody who attended, and to Melanie particularly for bringing this important matter to our consciousness. And we'll look forward again.
Thank you. Yes. See you next time.
Thank you very much, everybody. This will be available on our YouTube site once we have transferred the recording to the appropriate format, hopefully by the middle part of next week. Thank you, everybody. Bye-bye.